It's a hospital community effort to work together to combat the opioid crisis here in Pennsylvania. To date, hospitals have been doing extraordinary work in their own communities, and part of this effort is to build a platform for them to share their best practices, to share their struggles, and work collectively to find new ways to improve the care that they offer their communities.
And so we brought together a number of different initiatives within Einstein to try to assist our primary care docs who are handling many people with chronic pain and opioid use. The behavioral health side, which was seen to be very important to everyone within the organization, and our emergency department, which was always looking for increased access to superb care for people with opioid use disorder, primarily with the use of MAT, medication-assisted treatment.
We started a warm handoff program in 2015, working with the 3 hospitals in Armstrong, Indiana, and Clarion counties. And our model for that warm handoff program is using a team of case managers and certified recovery specialists in the emergency department to facilitate warm handoff for overdose survivors is really our target demographic, but we really quickly realized that substance use as a whole, the hospitals that we had partnered with weren't really equipped to be able to facilitate placement into treatment. So we really wanted to involve our peers, our recovery specialists that have experience as people in long-term recovery. So they self-identify as somebody who has struggled with addiction and has overcome that and is now living in long-term recovery.
So hopefully we'll be able to use the land to partner with other hospitals and programs so that we don't necessarily have to reinvent the wheel when it comes to new initiatives going forward.
We created in Reading a 24/7 on-site warm handoff program. We see about 140,000 patients a year through our single-site emergency department in West Reading, Pennsylvania, and about 3 to 5 of those patients are overdose survivors. And what we saw, unfortunately, was that we weren't doing anyone any good by giving people Narcan and letting them go without any intervention. And we learned the hard way that wasn't the right approach to take. We had some pretty sobering cases that came through the emergency department that caused us to relook at our strategy. And what we ultimately wound up doing is treating an overdose like a heart attack or a stroke when they come into the emergency department.
It's our pleasure to support this initiative. We recognize that hospitals are really a linchpin in this crisis, and that the opportunity to build capacity in emergency departments to be able to connect folks who are coming in on overdose or with opioid use disorder to medication-based treatment, we believe will really help to turn the tide on the crisis of deaths that this state has seen.